Hello. We'll get started in just another minute or two here, waiting for everybody to join. Thank you all.
I feel like we need some elevator music or something.
I know, I was just going to say that. Seeing some chats come through. You don't have to be camera ready. It's just myself and the speakers today, the panelists. All right. Well, what do you say? Let's get started. Welcome, everyone, to today's webinar, where we're going to discuss what happens behind the digital front door of healthcare. Steer Health recently launched this webinar series to bring industry leaders together and learn from each other on how we can utilize technology to improve the patient experience throughout their healthcare journey. I'm Sharon Razzo, and it's my pleasure to be serving as the moderator today on behalf of Steer Health, where I serve as the Senior Vice President specializing in customer experience, growth, and insights. I've been fortunate enough and lovingly have had a 17-year-long journey in digital health, where I've had the privilege of contributing to the success stories of various healthcare organizations that put the patients at the forefront. And during today's webinar, we'll discuss the concept of the digital front door. You're going to hear us say it a lot, but it's important. And what makes a good digital front door so important for patient experience, as well as care coordination and revenue generation. For the discussion, we've invited Valerie Choniuk, National Director of Patient Experience at Agilon Health and founding member of the Patient Experience community, and Joe Diver, CIO at Holyoke Medical Center and renowned digital health strategist who's lead digital transformations at multiple healthcare organizations. Valerie, would you do the honor of introducing yourself first?
Yes, thank you so much, Sharon. It's a pleasure to join all of you today. Valerie Choniuk, National Director of Patient Experience at Agilon, where I lead enterprise-wide CMS patient experience CAPS and HOS survey performance for value-based care for our global and professional direct contracting and Medicare Advantage lines of business. I know that's a mouthful. In a nutshell, it means I collaborate with influential healthcare leaders and physicians across the nation to really reimagine and transform the primary care delivery experience for our seniors. I have 20 years experience from corporate hospitality to across the healthcare continuum. I'm a certified patient experience professional, and as you already said, a founding member of the patient experience community. When I'm not focused on business, I lead a very holistic lifestyle in the Sunshine State with my amazing husband and 3 beautiful children. Happy to be here. Thank you.
Thank you for joining. Joe, we're very excited to have you here as well. Could you give our audience a brief introduction?
Sure. Thank you, Sharon. A pleasure to be here. Joe Diver, 25 plus years experience in health IT, number of years as CIO at different health systems and EVP on the digital health front as well prior. And recently joined Holyoke Medical Center as their CIO back in February this year to lead their digital strategy and their overall IT strategy itself. And prior to this, I led innovation at a $5 billion health system down the road here in Massachusetts. I love how Valerie talks about the Sunshine State while we're talking about the snowy New England, about the start up here soon after Thanksgiving. But anyways, pleasure to be here. And thank you all for attending.
Thanks, Joe. Thank you, guys. Thanks for the introductions. I would like to welcome the audience to leave any questions in the Q&A box so we can include them either in the discussion or answer them at the conclusion of the call today. But let's get started. I'm going to start with you, Joe. You've worked on the modernization of numerous healthcare organizations with the digital front door. Could you give us some insight into how this concept has evolved over the years? What makes it different from just a shiny new website and some digital marketing?
Yeah, no, that's a great question. If we kind of look back 10 years ago, what's a digital front door then and what is it today? It's really a focus on the consumer and the patient and taking the friction out of their journey to access care and how do they navigate the complex systems of healthcare. And certainly depending upon the region or the market that you're in, you may feel some of that external competitive threat from the Amazons and things of that nature. But most importantly, in the lens that we look at locally here, is that we are 85% government pay. So how do we help navigate our patients through that friction and make it as frictionless as possible, and leveraging the technologies as the front door of the website or engagement through chat or whatever the case might be? What's the right model for your institution, for your consumers at the end of the day, and really do that exercise to understand your population before you make some major investments.
Valerie, do you have some thoughts on this one as well?
Yeah, I completely agree, right? We are now a consumer-driven healthcare world, and we need to meet patients where they're at. And if that means from a technology standpoint, just like Amazon can do it, right? Everybody, we've got to get on board. So I absolutely echo his statements. And I think that how we design that and the different stakeholders that are involved in designing and implementing a digital front door are very important. Joe, I'm sure you have many different thoughts on this, but to your point with the patient in the forefront, right, getting leadership involved and then also making sure patients have a seat at that stakeholder table is imperative. So
definitely. It's crazy how it's changed over, since my 17 years, you're 20 and 20 plus, like it's a huge difference.
Even over the last 5 years, Sharon, I'd say it's really pivoted, right? It's just incredible. What consumers are asking for, what they're, when you kind of see the trends of the utilization, when it becomes important for them in the engagement, and how do you take that friction out, and certainly patient-centered through and through at the end of the day.
They've been raising their hands for a long time. I think we just finally came around to listening. So I have a question for both of you next. What key challenges should a good digital front door solve? Joe, want to go first?
I've mentioned the frictionless journey a couple of different times, but it's really meet them where they're at, and how do we understand that that particular challenge. So, for example, the more we know about the patient, the more we can serve up those journeys specifically for their particular situation. Good examples of this are if we know that the social determinants of health issue, that there's lack of transportation, let's make virtual first an option for that population. If the patient has a health literacy issue, let's understand that and serve up content that meets them at their literacy level, or give them the support they need to understand that particular part of it. So the more we know about the patient and that population, the better. And that's not an easy task for healthcare. And it's probably much easier for the larger marketing consumer product space, but how do you deliver healthcare as a product and leverage some of that capability there, that knowing the consumers and being able to surface those personalized journeys as best as possible?
Yeah, we say at Steers often that we try to, the literacy piece is very important. If they can't understand, if you can't read the content, so setting up, even just the information that are on your websites or put out in space, like at 5th grade reading level at the most, you got to think through those things. And so Valerie, what are your thoughts?
Yeah, I think just getting back to basics when it comes to access, right? Difficulty in seeing a doctor quickly, finding an appointment that fits your personal schedule. The scheduling process itself, I think oftentimes there's too many options and it's matrixed, and the need to provide too much clarifying information that then kicks you an error message that says, please call the office anyway. Very frustrating, big waste of time for patients. Using the technology to support staffing shortages. I think everybody's impacted by that right now, especially, and then it negatively impacts their service levels. And that's a short-term solution. Don't make that part of your long-term plan in healthcare, right, to save a buck. I can assure you that's not sustainable and it will eventually backfire, but being able to augment the perception of those service levels through the technology, or on the back end, it should solve and support your data and analytics teams, like what Joe was saying, to really improve productivity and performance of all of the clinical information. I think healthcare organizations have so much information that we're not doing anything with. And as Joe stated, really being able to funnel them into those necessary programs to be able to provide the appropriate care experiences that fit their lifestyle and their medical needs, which then, builds the framework to support physicians to prioritize their day. It ends up being a huge trickle down effect, positive or negative.
Absolutely. Wow. Okay. So, Valerie, we have another good question for you. How does a good digital front door serve the patient or the patient experience?
Yeah, this is certainly multifaceted, and I have many, many thoughts on this that could also keep me up at night. I think a good digital front door serves patient experience when it has an omni-channel approach for interaction, whether that's on the front end or the back end. Front end for patients, family, and caregivers to just simply drive ease. And as I mentioned before, for the back end employees who manage all of that. As an example, is a patient a diabetic? Do they have trouble getting their prescription refill or getting scheduled timely for their regular labs or preventative screenings? Those are things that a digital front door could really solve for and help to make that experience more fluid. I think a good digital front door is evolving into a unifying experience, right? With patient engagement, creating holistic experiences. It's not just utilization of technology and tools and apps and it being transactional, right? It's really about transforming how we do business. So whether you are a large healthcare system or a small hospital, again, as Joe stated, dissecting the fragmented entry points, the various different logins, whether it's for online appointments, those test results, your telehealth virtual visits, your login for a portal, for online education, for bill pay, a chat box, wayfinding. I mean, oh my gosh, there's so much. And it's not about having just multiple softwares and multiple credentials. It's about creating one login for everything that's interconnected. And practically speaking, whether it really is or isn't, it's just creating that perception on the front end that it is. So my last thought, in healthcare, we're all humans and driven by high emotions, whether that's fear, anxiousness, nervousness, confusion. And when it's high emotion, we need to be able to quickly and seamlessly access what we need when we need it. We don't need the wrong password to create that friction and then causes more stress. When we're working with technology, we need a digital front door to serve patient experience, the human experience, by enabling humans to do what they do best, provide compassionate and efficient medical care, not a digital front door to create a more transactional, fragmented, mechanical, or cold experience. The digital front door needs to enable the human experience, not replace it.
So well said. You touched on this for a moment, but why should the digital front door not only be patient-centric, but also focus on the staff and, this synchronicity of between patients, doctors, nurses, administration, but also with the patient in mind?
Yeah, I would say during COVID, I witnessed this firsthand, the breakdown when the digital front door was implemented too quickly and nobody was ready for it. For external customers and our internal customers, the staff really suffered and could not keep up. As patients were complaining, so were physicians and managers and the associates, because they weren't properly trained, because they didn't go through enough service recovery, because they themselves were not used to the technology, right? It was new to them. It was just a complete breakdown of the system. So it absolutely has to be staff centric, where they help to support and create the system. It can't just be a top down, okay, here, this is what we're doing. The best people to come up with the solutions are the boots on the ground and the ones in the trenches and the ones working with your customers and your patients every single day, because they're going to be the best ones to come up with those solutions and be able to really drive the type of experience that you're looking for. And I think a lot of us often forget that our employees, a lot of them are our patients too. So.
Absolutely. Joe, I saw you came off mute there. Do you have a thought?
Yeah, so well stated, Valerie. And every time I talk to you, I walk away more inspired and looking at opportunities to improve. But the staff and whether it be front desk staff or the physicians, they're also critical in the process, because they're also able to help educate our patients and their family members about the different ways to access care, to take the friction points away. And if they learn about new friction points, to surface those so we can address those timely for our consumers at the end of the day. And of course, they're all patients, not only the employees, but their dependents, their children, and also maybe even their parents if they still live in the area. But they're a critical component to the success of those programs. A great just quick story during COVID. Many hospitals started the wait in the car, for your lab test or schedule in advance. And it's kind of like the barbershop, the hairdresser. You're already checked in, and you're walking ahead of people that are waiting in line, and they go, "What happened?" Right? Well, you can actually check in from home, so you don't wait around in a big group. And just very simple things, right? To use staff to transform the process for all involved at the end of the day, but a critical component in the success for sure. So.
For sure. I know Valerie gave a couple examples, but is there maybe a personal example or more example of where things go wrong? Where do we go wrong in for the patient experience in this example?
Yeah, I would just say as a blanket statement that I think everybody can relate to is that when it takes too much emotion for you to do something, right? Or if you're already very emotional before interacting with the digital front door, higher emotion means you need a human being involved right away. You asked for a personal example. How many times have I been on the phone and I'm like, agent, or representative, that I'm getting so frustrated, right? Because the technology is not working with me as intended. And the more likely you need a human being, right? So high emotion equals you need the option to get a human, right? And if it's something that's more of a monotonous task, then you're more likely to rely on the AI. So something like being able to just schedule a annual wellness visit, or any type of visit that maybe isn't an office visit or a sick visit, or if you have a question that you need to get from your healthcare provider answered rather quickly, because it's either a choice of I got to go to an urgent care or an emergency room, where you're trying to keep me out of both and keep me within your care. And we're talking about value-based care, right? Really focusing on that physician-patient relationship. It could be seconds of a difference. And if I'm highly emotional, I might make an irrational decision for something, which now drives up the cost, right? The cost of care. So I think in a nutshell, high emotion, we need humans involved right away to help with that decision tree process. And if it's something that's a little bit more monotonous, then we could do that on our own self-sufficiently with that AI.
Absolutely. All right, Joe, $1 million question here. How can a good digital front door increase revenue for healthcare organizations?
Oh, that's a great question. It's always something you have to look at, especially when you're running thin on the margins at the end of the day, right? What's the value of the investment? And I think there's two paths you can look at. There's two paths that I look at specifically. It's we're still in this fee for service and value-based care model, but if I have capacity in certain service lines, how can I direct or engage consumers to fill that capacity? But on the parallel side of the track, I have a value-based care program and financial incentives aligned with the VBC programs. How do I ensure that my diabetic population, for example, in a particular payer, I meet the high threshold for them to maximize the incentives received in those particular programs? But most importantly, and it's not the hard dollar ROI at the end of the day, but there's a lot of soft. And how do we cut the cost out of healthcare for the consumer? How do we navigate the consumer to the right level of care at the right time? And this could be soft and it could be hard, meaning that I could redirect a patient away from my ED and send them to urgent care, or send them to async, on-demand care. Although we don't have that set up currently today at Holyoke, but it's in the industry. And how do you leverage the technologies to redirect the patients to care now at the right level of cost, and they're going to receive the high quality that they expect at the end of the day? So it depends upon where your health system is on their journey of the fee-for-service value-based care, but align that ROI is critically important. Give you a great use case in a prior organization. This is looking at the mammography screenings, average 90 patients a month. We reached out to patients that were overdue, provide the education, took the friction out, provide them the right level of health literacy. And the first month launch, we added over 300 additional appointments for the month. So how do we take the friction out of the patient, bring them into the healthcare journey, and get the value? And certainly there's a revenue component of that, but most importantly, there is a healthcare outcome quality component for the patient that we all should be focused on at the end of the day.
Make it easy,
Make it
and
easy.
less disjointed. You need, no,
Right.
that makes, yeah. A question for both of you. Can you give us an example of common mistakes or missed opportunities for the digital front door to be seen in the healthcare space? Valerie, maybe you want to go first.
Yeah, actually, that ties in well with what you had just asked Joe, because I also think a common mistake when it comes to experience is that so many in leadership are looking for that short-term ROI, right? That immediate revenue potential, when experience is a long game. It's a very long game for ROI. So being cognizant that it takes a village, it's a culture change, it's truly transformation in how we're doing business. So that would be my first initial answer as it relates to the question I just asked prior. But a common mistake that I think is too often, we're not focusing on that attract stage when it comes to the digital front door, or that awareness stage. And I think most people aren't even aware that that stage exists. Oftentimes people think a digital front door starts with that search stage, when a customer is actively looking for care, when the reality is the first impression or perception of how they feel about your organization is prudent. I think we can all relate when you think of any type of organization, when a friend recommends a place that you've never been to, but you've only heard through word of mouth, and you're like, really? That's good. You like going to that store? That's interesting, right? In that awareness stage, we are consumers. We're not even yet patients. We're making choices consciously, unconsciously, engaging before actively seeking care. This includes things like just having information, the education about, okay, is this close to my home? Is this convenient? Or who has the highest ratings when looking at social media or Google reviews? What is someone in my community saying when I go to my son's soccer game, or when I'm going to church, or right, just playing at the park and overhearing different parents talking about their experience. It's really about thinking about how the community sees it, and not just focusing on that quality of medical care, but also that quality of customer service, because that feeling that you leave others with, even if it is before they've interacted with you, right, that's going to drive their future decision making. So I would be very conscientious that things that people get wrong are thinking that it starts at the search stage. No, it's how you make people feel even before they've even interacted with your organization, based off of word of mouth.
To your point, yeah, we always say that, patients are willing to drive past 5 medical groups, 5 hospitals
That's right.
to find the right specialist, to go to somebody that they have a peer or a friend that trusted. So it's in my past, we would look at, okay, for primary care, maybe not as likely to travel this far or to go this distance, but when you're looking for an oncologist, you'll jump states if that's the need.
Right.
So it's very important that these opportunities aren't missed across, the digital front door, of course. To that point, Joe, do you have any ideas around missed opportunities for revenue growth in the healthcare space in this area?
There's always opportunities to improve revenue. It's just how do you make the investment and tackling that particular problem? I'd say some of the missed opportunities might be, I'd say a delay in revenue rather than a missed opportunity, meaning that I've seen some health systems that make major investments in EMRs and focus on the EMR capability, but there's so many opportunities around adding technology around the edges to really drive some transformative programs to attract and retain the patients even before they get into your EMR. And how do you make those investments outside of EMR investment to really then drive that? So I think it's delayed opportunity, because they'll get there when they possibly have external threats or other strategies that drive that. But as you kind of show a proof point, and then how do you then scale that? I think I would kind of, as Valerie was talking about patient experience, part of a culture shift and become part of that foundation. as well as transformation, different thinking of how do we execute these as programs and initiatives and really manage these patient experience and retention and engagement programs as almost like a service to the entire organization. So sometimes I take that investment and say, I'm going to impact 10 different service lines. I might spread that budget across 10 different service lines to then, be able to really move forward and hit that ROI across the organization. So it's really dependent upon what your strategy is, what's going to drive your push to that ROI equation. But I've seen too often that there's a delay in executing programs that clearly have a direct line to an improvement and in an ROI bottom line at the end of the day. So it takes that internal assessment initiative and leadership to make it happen.
Yeah. That's excellent. We do have a question that came through. What are the back-end challenges preventing organizations from delivering better front door experiences? The example given was real-time data access via streaming, data standardization, lack of expertise in development of AI, ML, LLM, augmented applications, etc. So what are the back-end challenges preventing organizations from delivering a better front door experience? Joe, I'll let you take that one.
Yeah, I think part of this question answers the overall question. It's really the data standardization. What data are you using to drive these programs? And so some of the challenges are the complexity of your data models, of the data that you have access to and availability to. But I would challenge organizations to think a very kind of crawl, walk, run approach, meaning that crawl into this digital front door space with some learning opportunities to figure out how you want to now leverage data in the back end. So for a example of that, we have a ton of data in healthcare. We have registries. We have all this data about the care of our patients. How do we leverage that data we have on a very basic level to then engage the patient? But then we start looking at AI and language models. There's a ton of opportunity to then take the friction out, but there's a huge investment to do so as well. So I would also lean on who's the right partner and who has some really strong data science behind it to give you the assurance that those programs are going to do exactly what they need to do at the end of the day. I don't know if you saw the study back, I think it was back in August. There was a study done about the compassionate care or language used in the model. And an AI model was 45% more compassionate than the physicians involved in the study. So how do you leverage that data to take the friction out, retain and attract that patient, and also the consumers around that patient, meaning their family members, et cetera. But I always start small, crawl, walk, run, and learn what data do I have available to really then scale or maximize those programs. But that's the trend that we're headed. I don't have the real right answer for this question, but kind of a couple different anecdotes, if you will. But
yeah, no, I think that summed it up pretty well. Yeah, there's a lot of infrastructure that is needed to be successful for the patient experience and to actually build all this out. So thank you. Great question from the followers. Okay, one more question from my end, and I know we have a few more that are coming through on the chat for both of you. For our audience, health leaders that join today, what action items would you suggest to improve their digital front door? Joe, do you want to take that one first? Oh, you're on mute.
Sorry, Sharon, as healthcare as I just got a text I had to look at real quick. Can you restate the question?
No, of course. So for our healthcare leaders that are on the call today, what action items would you suggest to improve their digital front door?
Yeah, it's a great question. I would start by having a kind of a key assessment group to assess what your goals and objectives are. What is a digital front door? What does it mean to you as an organization? What are your key drivers or key needs of your consumers, your patients, and then begin to develop a roadmap. And don't underestimate human-centered design in your roadmap journey. Go through your current state journey map today. What does it look like today? Highlight the friction points. what are the issues and what are the opportunities, and where those opportunities align with your short-term strategy, long-term strategy, and then you're able to develop a future state journey map, and then that journey map will inform what solutions or what processes you need to put into place to have success at the end of the day. That'll be my quick takeaway and key point for healthcare executives, leaders on the call today. Start with that journey map of current state and have the discussions for your future state.
Absolutely. Valerie, what are your thoughts on that?
Yeah, I'd say for organizations that have been doing this for a while and can't get it right, or those that are in their infancy because it's just can be really overwhelming, go back to basics. Start small. Keep top of mind to focus on modernizing the experience through simplicity and ease, right? That's a common theme today. We've talked about that, simplicity and ease, because patients will always have favorable memories that will directly impact their future decisions, or unfavorable memories for that matter, right?
Right.
So less is more. We touched on it earlier. I'd say get your frontline involved, hear what's working well, hear what the friction is. Then bridge that gap between patient expectations and your own healthcare operations. If a vendor software solution is not unified, create a unified perception strategy, right? I think we all have different vendors that we work with that through not having cross collaboration, right? There's these fragmented parts of the organization that, this department hired this vendor, this department hired that vendor, and now we all have different vendors that the contract doesn't end until a certain time. So I want to leverage that because I got a good deal, right? So practically speaking, how do we make that look good on the front end, even if it's disjointed on the back end? Because your customer or your patient's experience on the front end is a direct correlation to the mess or whatever's happening in the back end, right? Like it's very evident when you have that 30,000 foot view. So create that omni-channel approach, continue to design, redesign, develop, test, again, identify those barriers, then that's just going to continue to trigger the change management process. And then you can scale up. And as Joe said, use those human-centered design techniques and being able to work with patients, right? Pull them into a patient advisory council, ask them how they feel. Hey, this is something we want to deploy. Would love for you to interact and play around in it. Get different demographics to engage in it as well. You don't get a second chance to make a good first impression. So if you're going to roll something out, keep it simple, but pull out all the stops when it comes to getting your end user to interact with it. Because there are going to be things like we noted earlier with literacy. There's going to be things with language barriers. There's going to be a thing with age barriers. There's always going to be something. So how do we get ahead of that to be able to create that experience that's very favorable? Because if you don't catch some of those things, some of the smallest things that you wouldn't imagine can greatly disengage people. And I don't know about you guys, but once I'm disengaged from using something, like I'm never using it again. Like I stick to what's easy. I stick to what I like. I stick to what works most efficiently, not just for, my brain and my mind, but because it's just simple. And then that's what I'm going to use to recommend to others. So in a nutshell, use your own system regularly and be like undercover boss. Continue to use it over and over again and perfect it.
Yeah, the disjointed piece that you mentioned too, from the healthcare technology standpoint, like I always say, you may have a house and then you add on a room and then you add on another room. And this room is for scheduling and this room is for new nursing staff and this room. Sometimes you just need to buy a new house and establish a new foundation that makes it a seamless experience for your patients, and the staff will have alleviated, efforts that they are having to put in across the board. So there's a lot that can be done to improve the digital front door, just even in, establishing a vendor that truly can cover all all that ground.
Sharon, I'm laughing because before you know it, you have a bathroom next to a kitchen, right? And then that's
do.
not going to work for anybody.
Or you can't get out into the backyard unless you go through like the master bedroom or something.
Right.
I love your analogy of the house, Sharon. Just real quick, I heard somebody say that similar analogy, but they said start with that vision first to know if you need an additional foundation attached to your original house to extend the house, or else your whole house is going to collapse. Right. So what's that foundation layer, and then start building and expanding and things of that nature. But it's spot on. Right. So.
Yeah. And then like the roof, think about like, how does that, it's interesting thinking of it from that perspective, because, there are so many different technologies out there that can support these many efforts being put in, but at Steer, we really try to focus on the full house. So that's awesome. I know we have some more questions from the audience. I think one was on culture that you brought up, actually, Joe, a little bit earlier. What advice would the speakers have? I'm going to highlight this message. For organizations on establishing the right culture to make sure that the digital front door strategy delivers great results?
Yeah, it's a great question. And I always start with a conversation with leadership as far as the vision and the idea and the concepts around the digital front door. Because just like with any organization culture, if staff do not understand, or if consumers don't understand, or if there's friction behind it, it could kill your strategy pretty quickly. So culture starts from the conversation with the top, possibly even including your board, depending upon how big of an organization you are. And then be able to do these assessments of human-centered design and journey map activities to bring that back to that same leadership team and say, okay, these are some of the assumptions you made coming into this. This is what this exercise, this assessment is showing us. Are we still on the same path? So it takes a few kind of exercises through that, but building that culture. And when you have your CEO start talking about digital front door, you hear the language within conversations. It's beginning to be built into the organization's culture as a key tool or a key platform to then engage your patients and retain them and deliver excellent care. So definitely, establishing that right culture framework at the top is critical, in my opinion.
So true. I always say, like, when I go into IT departments and we're like, hey, we're doing an integration, and they are like, okay, they're checking boxes versus it coming from the top down saying, the reason we're doing this is to improve the patient experience, to bring revenue into the organization. And it's odd to have to re-level set that. So you're right. If it's coming from the top down, they're going to understand that these are either revenue generating activities, staff alleviation activities. Like, there's things that often aren't communicated, and culture is a huge piece of that, in my opinion. Valerie, did you have anything you wanted to add there?
Yeah, I would just say that, from a leadership perspective, everybody needs to get on the same page, because different leaders are going to have different priorities, right? Whatever they manage, whatever they oversee, whatever their KPIs are, that's what they're going to want to push forward. And it really needs to be a cross-collaborative approach for everybody to be interconnected and see, like Joe was saying, if you do the journey, okay, how does this impact that? Oh, I didn't know that what we do impact, right? So being able to really connect those dots and see the bigger picture is a very big deal.
Right. Yeah. Oh, I have another good question here that just came through. What would you say is the biggest internal hurdle to overcome when choosing the correct vendor to partner with for improving the patient experience and communication?
I'm going to give a very generic answer on this one. I'm going to say your vendor has to have very good customer service and provide you a very good experience. So just like how we go on interviews for different jobs, make sure you're interviewing all these vendors. Make sure that they don't eventually nickel and dime you for different ideas, because as you scale and as you find issues, you're going to want to make lots of changes. You don't want them to say, oh, it's going to cost X for us to upgrade this, or you didn't choose this in the initial package. And you're like, well, I didn't know what I didn't know at the time, right? So being cognizant that you need to be agile and flexible and have a vendor that's really a partner, someone that's going to work with you through all of these pains and friction that you're going to experience, because I think it's a learning curve for all of us. And if you've had positive experiences with certain vendors, they are continuing to drive things forward in the technological AI world. So keeping up with that is important too, because there's many vendors that I've worked with 10 years ago that I thought, but they have proved otherwise and now show me what they can bring to the table. And I'm like, okay, I'll reconsider this. You've maybe changed my expectations here. I'm gonna think about this differently now. So definitely the biggest internal hurdle would be make sure that they're going to provide you excellent customer service, because if they don't provide that to you, you're not going to be able to provide that to your patients.
music to my ears because I run the customer teams my whole career, and it's just so important. And it's also like looking out for the red flags too. If they're
Right.
not going to give you a direct contact, if they're not, if it's going to be a month to do training or 6 months to implement, you just have to find those red flags in those conversations to make sure you're not, jumping into something that ultimately will lead to, lost trust with the patients, but also in leadership, where you suggested this vendor come in and support this need, and then you have a little mud on your face. So that's awesome. And Joe, did you have a thought there as well?
Yeah, I think the question kind of lends itself to that word partner. And when you're looking at making these investments in digital front door strategies, what are the mutual metrics of success that we're going to achieve, and how do we evaluate our success year over year? Like, I would not do a 5-year agreement. It's kind of one of my things. I want to do an agreement in which it's driving success, but also the vendor becomes a partner in which, if I'm not doing my job as a CIO,
Mhm.
isn't it a partnership that you have direct line to the COO or CEO to drive that change or to highlight that recommendation? It changes the landscape of that partnership to really make the impact that we all want to do. The one that the vendor pitches and they become a partner, and the one that we want to achieve for our consumers and for our staff and for the organization as a whole, for sure. So it's a different relationship structure that I like to develop with these partners at the end of the day, because I don't consider them vendors. We pay them, but they're partners for success.
Mhm.
So.
I always say we want to be an extension of your team. So when we start, we will say we work with you and we are a part of it. Like, it's the extension of the team is a very, very key piece in vendor selection, I think, too. So partnership, love it. What else do we got here? Any other questions? We do have one that kind of hits back on the ROI. It's thinking of financial ROI and real tangible outcomes needed to push projects forward. How can we measure the impact of the digital front door tools to understand whether they are working or not? This is a key point, and I think a pivotal point in my career that's always coming up is proving it out. What do we think here? Yeah, Joe, go ahead.
It's really the baseline measurements of your current state and being able to get that measurement. And sometimes you may not be able to, but you have a hunch, right? So, maybe, quote that ROI based on a hunch and see what the assessment brings you down the road. But most of the time you'll find some key metrics that you want to improve. Otherwise, why would you be putting in the digital front door at the beginning? Even as simple as I stay simple, right? How many low value questions can be rediverted from your call center to an AI or to a chat bot or things of that nature? How many of your available annual wellness visits that you want to recapture have been reclaimed in that period of 6 months or a year? What's the impact of particular value-based care work stream? But most importantly, measure your consumer's experience with the product or with the program. If that's a low star rating, back to Valerie's points earlier, you have problems. It's not really an ROI, but as Valerie mentioned earlier, it's a long-term journey, long-term game. And those insights will tell you exactly if your early stage development of your digital front door is working or not for your consumers.
Yeah, we've talked about lifetime value for however many years, and this place, we actually have an opportunity to keep that stickiness, to keep our patients ingrained in our healthcare organization. So, what a great thought there. So let me see. I think there might be a few more questions, and we might just follow up with those a little bit later. I would love to hear final thoughts. Valerie, maybe you want to go first on this one?
Yeah, I've said it before and I'll say it again. Keep it simple. Don't overcomplicate things. As soon as you overcomplicate it, again, that's going to transpire to your customer and to your patients. Just like Joe said, if you're going to roll something out, you could just simply ask a question at the end of it, right? Let's just say it was online appointment scheduling. How was your experience? 0 to 10. You don't need to ask a ton of questions. You don't need to give a full-blown survey. It's just, let us know how we did, right? And then if there's an issue, think about creating a cohort of those patients that are allowed to say, tell me more. Would you be interested in using this? And telling us more about how you've experienced it, or what the friction points are, where you became frustrated, or what we could do better, right? Having humility that this is a learning curve and it's okay to have your patient have a seat at that stakeholder table to say, even if it is thousands of voices, right? You sit it down as if it's one, because you're going to aggregate and you're going to see a lot of common themes. All right, what's the low-hanging fruit? Okay, let's start with that. And then the stuff that's a little bit more complicated, work and have that cross-collaborative approach to be able to solve. If we continue to work in silos, we're going to continue to have that fragmented approach, and that's going to continue to transpire to our patients.
Awesome. And what are your final thoughts here, Joe, as well?
I think thinking about the final thought, because one of the questions that you asked to prepare, and I've been thinking through it for the last couple of days. And one of the things I landed on is that we're all patients at the end of the day. So every type of digital interaction I have, whether it's healthcare or not, I think about how can I leverage this for the patients we serve, and don't hesitate to poke at your competitor to see what they're doing right at the end of the day, and just think through constantly, how can I make it better? How can I make this whole crazy healthcare landscape better for the patients and the families that they serve? Because I'm also a patient. I'm also a consumer for my own family. And then how do we improve it through our own experiences? You go to I'm booking travel and use an online app, and it's really easy, right? And it's simple. We just rolled out another little technology for patients not too long ago, and one of the board members said that he had the experience and loved it, right? And you go, we're getting somewhere, right? So constantly ask yourself the question. You all registered to learn more today. I would welcome to keep the conversation open as we go through our own journeys of health IT here and continue to learn from each other, for sure.
Right. It actually kind of leads into one last question that came up, which I might be able to help answer a little. And it was, where can we get this strategic guidance to take our digital front door to the next level? At Steer Health, obviously, this is, where we focus, and we want to help build the house. We want to make sure that front door is as wide open to these patients as humanly possible, but also make sure the infrastructure around it is solid. And we're conducting free assessments of your healthcare organization's digital front door. You'll find a link to request this assessment in the chat box. I think we're going to post that up here, but it's a great question that leads into hopefully a great answer. Thank you so much, Joe and Valerie, for this time, for your thoughtfulness and your leadership in the healthcare space. Truly, it's we need so much more of the Joes and Valeries of the world. But yeah, thank you. And that wraps today's webinar. Again, thank you for these great insights. And to our audience, I think we had about 35 people join us today. So very exciting. Follow up on LinkedIn. We're going to be posting more webinars like this in the coming months, at least on a quarterly basis. So again, appreciate everybody's time, and thank you all.
Awesome. Thank you.
Thank you for having us.
Of course. Thanks. All right.